Hi, this is Dr. Huang. In this video, I would like to talk about how to do two-way analysis of variance or two-way ANOVA using SPSS. So first, what is a two-way ANOVA? You will have two different categorical independent variables, and you will have one continuous dependent variable. Therefore, the dependent variable will be only one. You will have two different independent variables. These variables will be the categorical variables. I'll show you the example here. So we're going to show you the effect of gender and disease on the waist size. So therefore, you can see here you have one dependent variable, which is your waist size. The two independent variable is a gender. Gender is a male or female, and then you have disease. You have disease or no disease. Therefore, these are the two categorical independent variables. Now, this type of analysis we need to use two-way ANOVA, our open database, which is called Bipolar 49. The data from patients suffering from bipolar disease. This is human data. Now we can see here what you need to do to go to analyze. Then you go to general linear model to use univariate. Here you have one independent variable. Now we say this independent variable will be the waist circumference. Then you have a fixed factor. First by the gender, number two by the disease. Now those are the two independent variables. We look at the option. We take the descriptive statistics, homogeneity. We can take the estimates of the effect size. Then you use estimate margin means. Then we can use gender, or we use disease, and the gender and the disease combined, whether this interaction effect. Then we select a compare main effects. We can use LSD or Bonferroni test. It's more stringent if we use a Bonferroni. We say continue. This is a very useful function. We say plots, because this will show you an image. Now we put the gender into, put the disease in a separate line, gender into a horizontal line. I'll say add, then continue. Then you will have a report here. Here's our report, two-way analysis of variance. Here's your number of cases we have used. Now here's a descriptive statistics. The waist size in male 106.08 centimeters, and in the control group actually is smaller. And for females, you also have a bigger waist size than the control group. Now we look at the Levin's test for the equality of variance. You see here, this is here. There's no difference. Therefore, we accept the null hypothesis. This is equal variance. Now we look at the report here. This is the main report. Test of between subject effects. We need to see this line. Look at the gender, whether gender has any effects. The p-value here for the gender is 0.001. Therefore, there is a gender effect. Gender make a difference in terms of waist size. Now, just one example I want to show you. Surely we know that there is a difference between the male and the female. I just want to show you the method how to do it. This is the disease. I also have the effect. So seems bipolar will affect the waist size compared to the controls. This is in both male and females, as I showed you before. You see here, this is the interaction, whether the effects is due to both. Actually, it's not, because we don't have a statistical significance here. Is the value here is greater, is 0.430, which is greater than 0.05. Now here's the main report. Now we look at here, give you a estimated margin means in terms of gender. You see here male and females, and adjusted surely. This is estimated. So you see, if you see here the statistical significance, male and female, there is a significant difference in pairwise comparison. Now this is for the gender. Now we look at for the disease. Now this is the disease. We look at pairwise comparison. There is a significant difference. So plot. How this is give you a good visualization in terms of male and female. And here in the male, this is, as you can see here, this blue line indicate the patients. If you see the patients here in male, the patients with the bipolar is significantly higher than without the disease. Same for the female. This is the patients. This is normal control. If you see the two very much in parallel, there's no crossover. Therefore, this type of image indicates there's no interaction. So now we go back to our PowerPoint slides. This is a summary how I did it, how I selected each function from SPSS. Now here's a report I copied from our report descriptive statistics. Here we look at the individual effects and interaction to see those numbers we had before. Here look, this is Levin's test. Now here pairwise comparison. This is about the gender. This is about the disease. This is how you write a report. I wrote an example for you, how you're going to write a report. You need to cover this. Here's your student practical task. So you can open a database bipolar 49. You can do some practice for two-way analysis of variance in terms of weight affected by disease or gender, or both. And then we have another one. This is a question I'm going to ask you: what type of statistics should you be performed? Should be performed? Then you look at this. Surely this is the two-way analysis of variance. Why is that? You will say two independent variables and one dependent variable is the stress. Is your dependent variable. Treatment and age will be two independent variables. Thank you for watching. I hope that helps you to do the two-way analysis of variance, how to write a report.